Hey you guys, welcome to Group 4's presentation on ergogenic aids. First, we gotta answer the question, what are they? What are ergogenic aids? So they are substances that enhance energy production or recovery after exercise to give athletes a competitive advantage. They're not always steroids, but obviously they fit pretty squarely into this category. And through a survey, 50% of the general population reported taking some kind of dietary supplement, which same thing as ergogenic aids. And so that just includes like the average Joes. They're talking about like vitamins or diet pills or something. And then in a survey of college athletes, it was found that a large portion of them took some kind of supplement. So that includes like protein or energy, like pre-workout stuff, or creatine. So it's super, super common that people will take ergogenic aids in some form or fashion. And there's a lot of confusion in the community about like how effective some of these supplements are, because if they undergo any type of like FDA inspection or like studies about how effective they are, they're normally done with athletes or like really conditioned adults, and normally males. So if you're a teen girl, they aren't sure how it'll affect you. They're just not sure. So it makes using it really confusing for like teenagers. And part of these ergogenic aids are nutritional aids. So that includes like vitamins or caffeine or creatine. And we all know what caffeine is. We are all really tired all the time, so you have coffee. Or those little pills. If you don't like coffee, they have caffeine pills at Walmart or something. There's also creatine, which helps enhance like the production of ATP in your body, which would obviously help you perform better like in the gym or at a competition. And then there's vitamins. They do a bunch of stuff in your body. They're super helpful. If you aren't sure that you're eating like the right stuff or enough greens, leafy greens or stuff like that, you can take a vitamin and they can help you like fill in that gap. So that's nice. And then we've got kind of like the more, controversial, I guess, nutritional aids. So there's carnitine, which helps spare glycogen breakdown and decrease lactic acid production, which is great because if you don't have lactic acid, then you can keep going. So that's nice. But it also increases defecation while you're performing even. So I don't know about you, but that's not good for when you're competing. That's not nice at all. So please don't take that one. And you got the second one. It induces protein synthesis in muscles, which are stimulated by the release of growth hormone. So growth hormone, you grow, your muscles grow. That's super helpful. And then there's blood doping. And so if you have more blood, you can carry more oxygen, which is nice, but that's also dangerous. So please don't do that. So that's why those are controversial. Please don't do those things. And then you've got some of the negative side effects of prohibited substances, much like the one we talked about with the defecation. That would definitely be on this list. And so starting with steroids, there's severe acne, there's hair loss, liver disease, kidney disease, testicle shrinkage, roid rage, so much stuff. Don't do steroids, please. Please don't do that. They're not good for you. You can also get an infection if you're not good at giving yourself needles. So please don't. And there's creatine again. Some of the negative side effects are like muscle cramping, diarrhea, nausea, dizziness, just a whole bunch of stuff. If you don't read the back of the package, you're going to hurt yourself. Then there's caffeine. So obviously, if you don't time that correctly, you will not sleep at night. There's also nervousness, restfulness, stomach irritation. Remember, it is it's an upper, it's a stimulant, so it will stimulate you. Then there's also protein powder. High doses of it, compared for like your body size, can cause like increased bowel movements, nausea, thirst, bloating, just general gross feelings. And then pre-workout, kind of going like hand in hand with caffeine. Some of the negative effects of that are insomnia, diarrhea, dehydration, all those gross things. And to prevent people from hurting themselves or compromising like their own integrity or like the integrity of the sport, there are regulations in place to prevent the use of like illegal or like controversial supplements that just haven't been deemed appropriate for like that sport. So these are known as anti-doping codes, and they're created by the World Anti-Doping Agency, aka WADA. And it just sets regulations for sports around the world and keeps athletes honest and healthy. And WADA also assists the National Olympic committees that just help out with major events and making sure everything is in tip-top shape for the Olympics. And all organizations are expected to enforce the code that the WADA sets into place. So that makes it super helpful. All the rules are in one area, one centralized location. Makes it super easy to keep with them and adhere to those rules. And some of the ways those are enforced are through drug testing. So there are different types of drug testing. There's random, so if people are just picked out of a crowd and now you have to go pee in a cup. There's also reasonable suspicion. So if you've been PRing like crazy out of nowhere and people are just concerned, they're like, they definitely are taking something, then they will pick you out of the crowd and then you'll go and take this drug test. And then there's general pre-participation or pre-competition drug testing, where before a competition or before you can even begin working with a team and practicing with them, you have to take some kind of drug test, just so that they can stay in compliance with the WADA. And then there's follow-up testing for previously positive athletes. So these are people who have already tested positive for steroids or something, and the people in charge are kind of concerned. So they'll just pull them aside and test them real quick to make sure they're still in compliance and they aren't taking anything that they shouldn't be. Even more, so widespread testing for anabolic steroids in urine specifically began in 1983 at the Pan Am Games. You've got peptide hormones, like growth hormones. They're detectable in urine, but they're difficult to test for and confirm as a positive result. And because many of the compounds have a short half-life in the blood and a low concentration in the urine. So obviously when you take a urine test, it's going to be difficult to see it. And that makes it really easy to become abused, and it's the most abused form of ergogenic aid that's illegal in sports. It's very common. And there are a lot of tests that have been developed to identify unnatural substances, things that should not be in the body. But it's really difficult to test for things that are commonly found in the body. So when people do look for those, they have to see how high the levels are and if it makes sense for the size of the body of the person that they're testing. And one way people can kind of cheat the system is to take a diuretic, because it can reduce concentrations in the urine. And one of those would be right there. It's a medication that increases uric acid excretion and can interfere with the detection of anabolic steroids. But since we know that, we've obviously found a way to get around it and fix that issue. A little bit more on drug testing. All around, people agree with drug testing. They want it to happen because you want to see someone compete at the best of their ability, not the best of their drug's ability. So when asked, approximately 60% of student athletes reported that they believe drug testing should continue and that penalties are fair and appropriate. And then they also thought that 80% of them believe that Olympic and professional athletes should be drug tested as well, because it matters. You want to see how people are doing, not, again, how good their drugs are. So that is all we have on ergogenic aids. Thank you so much for joining us.